To keep my hands on myself.
How pilamia yelo mitaku yepi. Hello, thank you, and welcome to all my relations who are here today. Again, my name is Dr. Donald Warne, and I serve as chair of the Department of Public Health at North Dakota State University. And I'm so happy and honored to be a part of this important discussion. And I love the name of it, celebrating the power of connection and community learning. In Lakota, we frequently say mitakuye oyasi, which means we are all related. We are all connected to each other. So the whole idea of celebrating the power of connection is what we are all about as Lakota people. And it makes me very happy and honored to see that this is our discussion here tonight as well. At the North Dakota State University Public Health Program, we offer the only Master Public Health in the nation that has an American Indian specialization. So our students can actually specialize in American Indian public health. And the reason that is so important is that we have terrible health disparities in our populations. And the health disparities lead to educational disparities and economic disparities. And we see, unfortunately, a vicious cycle in which we're not preventing preventable issues, and we wind up with a lot of chronic disease. So in our traditional way, we did not have a written language historically, but we do have a written language now. One was created after many years of not having a written language. But we learn a lot about our life lessons and our culture through stories. And there's a story of three sisters walking along a river. And as they're walking along the river, they see babies and young children in the water, struggling to stay afloat. And the first sister jumps in and says, "This is a crisis, it's an emergency. We need to get the babies out of the water right now." The second sister says, "No, we need to teach them how to swim so they can survive while they are in the water." And the third sister keeps walking upstream, and the other two get angry and say, "Where are you going? Why aren't you helping us?" And she said, "I'm going to find out who's putting these babies in the water, and I'm going to stop them." That's public health. That's working further upstream. When I think about what we do in modern medicine, we spend a lot of time, energy, and resources in crisis management, managing issues after they've already become a crisis, and relatively little in primary prevention and in public health. So that helps to establish a framework for what we do in our public health education. So I'm originally from Kyle, South Dakota, on the Pine Ridge Indian Reservation, and I'm very strongly and culturally connected to Kyle. I actually named my oldest son Kyle, so the namesake of my oldest child is Kyle, South Dakota. The traditional name is Prejutahaka, which means medicine root. And in this area, this is where a lot of our traditional healers are from, both historically and currently. It's also where we harvest a lot of our traditional medicines. We have our sage and other herbs and sweetgrass that grows abundantly in this region. So it's called medicine root, Prejutahaka. And as was mentioned, I was given my grandfather's name. My grandfather was Louis Stabber, and his Lakota name was Prejutawichasha, which means medicine man. And I love the way our language includes meaningful names. Our names have a meaning. There's a reason why we are given these names. So I like to joke when people ask me, "What does Prejutawichasha mean?" I tell them, it's Lakota for Steve. No, just kidding. If there's any Steves, I apologize. I'm just making a joke here. Well, this is a picture of the school in Kyle called Little Wound School, named after Chief Little Wound. And he was one of our Lakota chiefs, historically one of my ancestors. And it's kindergarten through 6th grade. And one of our big challenges is that less than half of our children who start kindergarten complete high school. So if we think about Mr. Reindel's discussion in the previous talk, that puts our children at high risk for poor health outcomes. And this is true, unfortunately, across many of our reservation communities. And it's true particularly in impoverished communities across the country and particularly impoverished rural communities. So the challenge then is, where is our next generation of doctors coming from? Where will we find the nurses, the business leaders, the educators, if we're not even finishing high school? And we know that this correlates to worse health status. Another challenge that we have is that we live in a food desert. You may have heard of that term. We don't have local access to a supermarket. From Kyle, the closest supermarket is actually in Rapid City. So imagine doing a 200-mile round trip when you wanted to go to the supermarket, and living within poverty and limited transportation. So this is one of the cafes in Kyle, and I haven't been here in years, so maybe they've improved the menu, But I was there a few years ago, and I think what they've learned here is that you can bread and deep fry just about anything and serve it for lunch. So we wind up having foods that can be stored for a long period of time, things that can be in a freezer and in a bag and then just put into a deep fryer, and then that's the food source. Across the street from that cafe is the gas station, which also has a convenience store. So people purchase food here as well. And as you can imagine, it's not the healthiest choices for food. There's also a concept in public health called a poverty tax. And it's not a real tax per se where the government is taking a percentage of the money. But people who live in impoverished communities like this have to pay more money for things like fruits and vegetables than people who live in Rapid City or Fargo or in a city because of the cost of bringing it out there. So I also liked Mr. Tilson's discussion about the need to invest more in food sovereignty and growing our own food. Well, if you can't afford to purchase food, there is a program through the USDA called the Commodity Food Program. You may have heard of this before. And the food available through the USDA has improved significantly over the years. When I was a kid, this is what it looked like, though. I remember these cans and containers. You can see there's a container of corn syrup, pure corn syrup, and on the label it said, "Use on your pancakes." Isn't that wonderful? And then canned meat, some sort of spam-like meat product, I'm not exactly sure what that was. Powdered milk, grape juice, and I think the grape juice was just sugar water with purple food coloring, and all the kids would have that grape juice smile on their face when drinking it out of the cup. You can see on the bottom left, that's commodity cheese. Very famous in Indian country. I think we all like commodity cheese. I like commodity cheese. I wish I didn't, but I do. Then we also had flour, and it used to be lard, then it changed to vegetable shortening. And now when we think of traditional food, a lot of people think of fry bread, right? Fry bread is traditional American Indian food. Well, it is not. We never fried dough. It's actually people doing the best they can with their commodities. So I tell my family and friends, if you want to call it traditional food, that's fine, but call it traditional USDA food, not traditional Lakota food. Well, why are we dependent on these programs? We have terrible rates of poverty. Nationally, American Indians and Alaska Natives live at about 2.5 times the federal poverty rate compared to other populations. It's even worse here in South Dakota, unfortunately. The map on the top is a map of the counties and shows the concentration of poverty in each of those counties. And you can see the counties with the most poverty tend to be the reservation counties. So this really is a community-wide problem. It's a statewide problem. If we look at the counties again, looking at a list, the 3 poorest counties in the nation are right here in South Dakota. Is that acceptable? Should that be acceptable to any of us, whether or not we are American Indian? We hear about the terrible poverty in the Deep South. The next 3 are in Mississippi, but then you can see that 5 of the top 9 are in either North Dakota or South Dakota. So terrible poverty. Why is that? Why do we have such high rates of poverty? Well, we have to think about this in a couple of contexts. One, a historical context, but also a cultural context. Now, culturally, we never had a system of currency. We never had money. That's actually a foreign concept to us as indigenous people. And if you think about money, it's kind of a crazy concept. Now, we used to be on the gold standard and money was backed up by precious metals. We now have more money than we have precious metals backing it up. So what's backing up our entire currency system? Nothing, except our collective belief that it has value. So we believe it has value. There's nothing backing it up, but it drives all of our decision-making in healthcare, education, business, politics. Isn't that remarkable? So from an indigenous perspective, this man-made concept of money is really foreign. It doesn't make any sense. Another concept within poverty is looking at land ownership. Now, historically, we never believed we owned the earth. And from an indigenous perspective, owning the earth is kind of a silly concept as well. The earth has been here for billions of years. In the sliver of an instant that is a person's lifetime, he or she can believe she owns the earth, and then the earth will be here for billions of years. Is that intelligent? Is it logical? So we have to recognize there are differences in cultural beliefs, but there's also a historical root for our poverty. Now, I always like to say when I show this slide, let's talk about Indian country. So we didn't draw the lines between US and Canada. We have relatives that live south of Winnipeg. We didn't draw the lines between US and Mexico, but for now, let's look at these 48 states. When we look at what happened historically, the 13 colonies were not good for the northeastern tribes. There's actually very few American Indians left in the Northeast. And it's not because historically we didn't like the East Coast, that, the traffic and the congestion and all that. It was actually because of the colonies. You may have heard of Amherst, Massachusetts, Amherst College, named after Lord Jeffrey Amherst, who was a colonial governor. And he's famous in Indian country because he is the individual who ordered the distribution of blankets from a smallpox hospital to the regional tribes with the purpose of killing them. You can actually Google Amherst and smallpox and even see the letters that were written back and forth. I like how the word Google is now a verb, right? We can Google this information. But in truth, it's not characterized this way, but the first documented case of bioterrorism is our own colonial government. Completely wiped out many of those tribes. You may have heard of the Trail of Tears in the 1830s when tribes in the southeast were moved to what is now Oklahoma. In that process, many of the tribal populations were split apart. Some people agreed to be removed to Oklahoma. Others said, no, I'm going to stay in my homeland. So that's why we have Seminoles in Florida and Seminoles in Oklahoma. Cherokees in North Carolina, Cherokees in Oklahoma. Choctaws in Mississippi, Choctaws in Oklahoma. And actually of the 40 or so tribes in Oklahoma, only 4 are from Oklahoma. They were all relocated from other places. The discovery of gold was not good for the California tribes. Unfortunately, many of them were wiped out completely during that process. So this is what we're left with. If we look at concentration of American Indian population by county, you can see the vast majority of our people are in the West now. And that's simply because colonization started in the East. If colonization came from the other direction, this map would be inversed, right? And what's interesting, we live in South Dakota, right? Do you know why it's South Dakota? The Lakotas were to the west, the Nakotas were to the south, and the Dakotas were to the east. So the first group that was encountered was the Dakota, so it's South Dakota. If they had come from the other direction, we'd be living in South Lakota. Little known fact. So at this point, I always like to talk about a brief history of medicine. Again, I like medicine and history and culture, so this is a very brief history of medicine. 2000 BC, here eat this root. 1000 AD, that root is heathen, here say this prayer. 1800, that prayer is superstition, here drink this potion. 1900, that potion is snake oil, here swallow this pill. 1950, that pill is ineffective, here take this antibiotic. And year 2000, that antibiotic is artificial, here eat this root. So we've kind of come full circle, haven't we? As I could say, getting back to the roots of medicine. Okay, I know it's a bad pun, I apologize. But I've done a lot of work also in alternative medicine. I have training in both family medicine, but also I did a fellowship in alternative medicine. So I like to say I finished the 26th grade by the time I was done with all of my training. But what's fascinating is that when we look at modern medicine, what's really taken out of modern medicine is the spirituality of healing and the cultural components of healing. And in modern medicine and modern education, we kind of take a one-size-fits-all approach. We focus on equality. Everyone gets the exact same curriculum, everyone gets the exact same medications, everyone gets the exact same package of services. That's equality. But does that meet everyone's needs? You can see on the left, that's equality. Everyone gets the same package of services. The guy on the left didn't need it, the one in the middle is being well served, the one on the right is still underserved. It's equality, but it's not equity. Equity is meeting people's needs, meeting communities' needs with the appropriate types of services. So we might not give everyone the exact same package of services, but we should be trying to raise everyone up to a minimum standard of living. And the best example I ever heard of between the difference between equality and equity is that equality would be like giving everyone a pair of shoes. Equity is giving everyone a pair of shoes that fit, right? We should be focusing on equity. I'd shown this slide many times, and someone emailed me this other slide. And the question is, why is there a fence there in the first place? What about the systemic barrier? Should we just be focusing on the package of services, or should we tear down the systemic barriers? Is discrimination a systemic barrier to wellness? Absolutely. Each of us has a role in tearing down that wall of discrimination between people. It's unnecessary. So we can develop programs to counter discrimination, we can develop social services to deal with the outcomes of discrimination, or we could just get rid of discrimination. Let's be that third sister walking upstream and focus on prevention. And this is the way we would approach things from a traditional perspective. I'm sure many of you have seen a medicine wheel, and it shows the balance among four forces: spiritual, mental, physical, and emotional. And in order to be healthy, we live in balance across all four directions. In my own medical training, we didn't talk about spirituality. The only time the word spirituality came up in my medical training was when I did my hospice rotation. We had to wait until there was an impending death before we acknowledged that people have spirituality. That's not very good. But look at the terminology here. Another word for doctor is physician, right? It's the same as physical. The Latin root is physic, and that means the natural sciences. So we spend most of our time really focusing on the physical realm and not being holistic in our approach to each other and our approach to healthcare. So in my experience in alternative medicine, I was around a lot of other physicians who are getting training in holistic medicine or alternative medicine, and I heard several of them say, we have found that when we incorporate spirituality into the healing process, it's much more fulfilling. And from a Lakota perspective, that's kind of like saying, we have found that apple pie tastes better if it has apple filling in it. So I tell them, that's very wise. So when we think about community health, we're talking about our communities, and we have to recognize that we have differences in our environments, in our cultures, but the determinants of health, cultural determinants in the spiritual realm, educational determinants in the mental realm, again, great discussion in the last talk, environmental determinants in the physical realm, not just the natural environment or toxins, but even the built environment. Is it safe to go for a walk in every neighborhood? Well, not necessarily. And then, of course, the social determinants of health in the emotional realm. You've seen this picture before. This is my great-great-grandfather, Chief Stabber. His son was Crandall Stabber, Crandall's son was Louis Stabber, and Louis's daughter was Beverly, who's sitting right there. Can you wave hi? So Beverly's other name is Mommy. That's actually what I And I have a son. My youngest son is Crandall. So my mom had a grandfather Crandall and a grandson Crandall. One of my great-grandfather's contemporaries was Sitting Bull from the Hunkpapa Lakota tribe. And I love this quote from him: "Let us put our minds together and see what life we can make for our children." Let us put our minds together and see what life we can make for our children. That's what we're doing here, right? It's going to take a generation to shift the tide from discrimination and bad outcomes to inclusion. We need diversity, we need inclusion, and we need to love each other. It's kind of interesting. I've worked in a lot of organizations where we say one of our core values is tolerance. That's setting the bar pretty low, right? I don't want to be loved, I don't want to be embraced, I don't want to be liked, I don't want to be accepted, I just want to be tolerated. And if I went home to my wife and said, "Honey, I tolerate you," I don't think she'd like it very much. So let's raise the bar collectively. This is one of my other favorite old photographs. This is Chief Red Cloud, who's one of our Lakota leaders in that same time frame, meeting with one of the federal agents. And I love the symbolism built into this and how our cultures hadn't connected as well as they could have over time. And you can see in the traditional Lakota way, you're supposed to be quiet and humble. You can see he's in a seated position. And look at the government agent standing over him from a superior position, looking down on him. And in our relationships together, let's focus on that handshake. Let's focus on how well we can understand each other and not just judge the differences that we see. And I always like to end with a quote from Black Elk. Black Elk was a Lakota leader, again, from that same time frame. And he met with a writer named John Neihart in the early 1900s, and they wrote the book Black Elk Speaks. This is my favorite quote from him. "Of course it was not I who cured. It was the power from the outer world. And the visions and ceremonies had only made me like a hole through which the power could come to the two-leggeds. If I thought that I was doing it myself, the hole would close up and no power could come through. And what he's talking about is humility, recognizing that when we believe we own the healing power, we lose our access to it. So in medicine, if we're not humble, we lose our ability to be effective healers. In education, if we're not humble, we lose our ability to be good teachers. In every discipline, when we lose our humility, we lose our effectiveness. Now, it won't come as a surprise to you. When I went to medical school at Stanford University, the core value was not humility. Believe it or not. But what I've seen in my own career is that when we are respectful of each other, when we're humble enough to recognize that differences across populations are a good thing, when we take the time to know each other, to care for one another, we can do powerful and meaningful things. And when we talk about community learning and we talk about the power of connection, that's what our historical cultures have been all about. And I look at these pictures of elders and I wonder, what are they thinking about our current generation? What would they tell us if they had the power to reach out to us now about how to live together and move toward a future that's much healthier for all of us? And let us remember that we all drink from the same stream of consciousness. We are all connected by that same stream of consciousness. We are all related. What we do to each other, we do to ourselves. Act kindly toward my people, for indeed my people are your people. Thank you all very much.